Thank you for joining me today. In this video, you will learn more about interprofessional care. Interprofessional care. Interprofessional care is a collaboration among healthcare professionals to deliver coordinated care, continue mental health care. You don't want to have the fragmented care. So that is why the interprofessional care is so important. You want to collaborate among health professionals to deliver a coordinated care, continue mental health care. So the goal of interprofessional care is effective psychiatric care depending on teamwork. Effective psychiatric care depends on teamwork, coordination, continuum of care across the setting, whether to be in hospital, outpatient, group homes, family setting, community setting. You want to coordinate and have the continuum of care across the setting. Interprofessional collaboration is working together with multiple disciplines to provide comprehensive patient-centered care. The key team members of collaboration psychiatric team include psychiatrist, it include nurse practitioners, it include nurses, it include psychiatric or psychotherapist or therapist. It includes social worker, case manager, peer support, family member. Those are the key members. Why it is important to have interprofessional care? It improves outcome, it reduces error, it enhances continuum of care. Your role as a provider is the central coordination of the care. You want to coordinate the care, communicate between team members, patient education, promote team response, advocate for the patient, and you want to be that system bridge as a therapeutic provider. Case management models. Case management models has a types. So brokerage model is a minimal involvement, refers client to the service. Clinical model is a strong provider-patient relationship, is ongoing support with the patient. Intensive care management is a high need patient who need a higher care, is a small case load, is a frequent contact. There's a frequent contact with the patient and the small group that you have. Strength-based model is the best practice. Focus on the patient strength, collaboration, and individual care. Recovery-oriented care has 4 domains. Recovery domains include healing, is the managing the symptoms. Home, you want to make sure the home is safe for the patient. Purpose, you want to have a meaningful role. Community, relationship, and support. Okay. Rehabilitative service. Rehabilitative service. This help the patient to function in the society. What are they? It is medication management. Those services are medication management, therapeutic, individually, family and groups. Is housing support, job training, social support, groups. The key point is treatment is not just the symptom control, it is functional recovery. So the goal of the treatment is patient to gain their function in the society and be one of the society, not to control just the symptoms. Discharge and transference plan. The purpose is to ensure safety transfer from one setting to another. Type of discharge is stand discharge, against medical advice, conditional discharge, assistant outpatient treatment. Provider role is to assess a readiness of the discharge, to identify the risks of suicidal or relapse, to arrange follow-up care, to educate the patient and the family before they discharge. Continuum of care. Continuum of care is you want to continue of the care that they had here in the inpatient. And it includes providers, setting, and time. Consequence of a poor continuation. If you fail to set up that continuation or the follow-up appointment, patient will have a relapse. There's a risk of relapse, risk of not adhere to the medication or not taking their medication. They will be rehospitalized. They will be coming back. It will be fragmented care. So you wanted to have cohesive care. You wanted them to take their medication and follow up their treatment. So you want to educate the family and have them set up the support group outside the hospital. Your responsibility as a provider is to ensure communication, coordinate the follow-up, monitor the adhesiveness to the treatment and the care. Telehealth and online therapy is a rapid expand after the COVID. The benefit is increased access, low cost, flexible care delivery. However, it has a limitation. What are the limitations? Patient may have a barrier to technology, privacy issue can happen, reduce personal interaction, the connection that you have or you can build with your patient may may be limited than when you have in a face-to-face meeting. As a provider, you want to teach the patient how to use the platform. You want to monitor their engagement. You want to ensure the confidentiality. Mental health and psychosocial support. Mental health and psychosocial support include counseling, psychoeducation, community programs, peer support, and the goal is to address both mental health illness and social determinant of the health. You want to address that. What are the challenges in interprofessional care? There is a fragmented to have that cohesive interprofessional care. Communication breakdown can happen. Multiple providers are confused what to do or who to contact. Access to interpersonal care barriers. There is a stigma involved with that. Interprofessional collaboration improves outcome. Provider coordinate the care. Strengths based case management is the best practice. Continue of a care prevent relapse. Discharge planning is a priority. Telehealth is the majorly trending. So team care. Team care is a team collaboration, education. You want to focus on team collaboration. You want to focus on education and advocacy. You want to monitor the patient. You want to continuously set up the continual care. You want to improve access to healthy and telehealth. You want to focus on recovery and engagement. Collaboration and coordinated care across the providers and setting is essential to long-term psychiatric recovery and patient safety. Thank you for joining me today.